Let's assess our capacity to expanding our isolation centers, increasing our bed spaces. We have joining us a public health physician in Lagos, Dr. Samuel Okerinde. Thank you for joining us.
For having me.
And from the United States, Bloomington, Illinois, Dr. Donny Ibeke, a medical doctor, joins us as well. Thank you, Dr. Ibeke, for joining us.
Hi, thank you for having me.
All right, let's begin with you, Dr. Ibeke. Tell us first how the U.S. is battling the pandemic, taking such a huge chunk of the global figures of confirmed cases.
Yeah, so you're right. Unfortunately, we're number one, and in a bad way. We have reached the 1 million case mark as of yesterday and over 60,000 deaths. So the numbers are still rising. The response has been mixed. Some states are easing the lockdown while others are expanding it. But what we can all agree on is that the testing capacity isn't where it should be and needs to increase. And a lot of the governors are stepping up to procure their own testing to help with this public health crisis.
Dr. Ibeke, with bed spaces, how is the U.S. coping with that? In Nigeria, we're recording about 3,500 bed spaces available so far with our numbers, yet we're also feeling the pinch, especially in Lagos and some other states.
Yeah, I mean, this has been the running theme all over the globe. This disease overwhelms healthcare systems. So, in our hotspot areas in the United States, you're seeing emergency rooms filled to the brim, patients overflowing into the hallways. So we've had to make makeshift areas. Central Park in New York was converted. The Naval Hospital ship has been based outside of New York to help deal with overflow. In Chicago, the McCormick Place, which is a big convention center, has been converted to a hospital. And then some places are diverting patients to less affected areas to help deal with this. But it's important to, find ways to, or find places that you can use, because this disease will overwhelm the healthcare system. So Nigeria is not unique at all.
All right, let's come to our guest here in Lagos, Dr. Okerinde. Bed spaces. I mean, you're in Lagos. You observed, that we have limited spaces. How do you think we can get past it? We also have, the isolation centers, like what the governor, flagged off today, opening another isolation center. But then there's also what the NCDC DJ has said, home care. How will that work?
Okay, thank you so much. We need to know that before the pandemic started, we've always had this perennial shortage of bed spaces. Sometimes you go to the ER and they tell you there's no bed space and they have to refer you. So it's really not unexpected, actually. But with COVID-19, like I've seen in other part of the world, in some European parts, you see a lot of patients, COVID-19 patients staying on, by the walkway. I think that with what we've seen so far, with particularly what Lagos State government is doing, we just talked about the new Bagada isolation center they just opened. Lagos State, of course, is doing so much to be able to handle the bed scarcity and the shortage in bed space. However, there's still so much to be done, particularly if you compare if you see the numbers that we currently have. We have, by today, I'm sure we'll probably be having 2,000 cases, with Lagos probably getting to 1,000. There's still so much that needs to be done.
When you say so much, how much more? People should open their homes so that, these spaces can be used. Okay.
And what other government, of course, what Lagos State, of course, have also done is the Onikon Stadium have been converted to an isolation center. We have one at Landmark. We have one at Bagada. There is a need for us to particularly convert those public spaces like our stadium. We still have the National Stadium there. We still have the testing, at least temporarily. We may need to put some form of isolation centers in those places. We know it's going to really cost a lot, and that's why we will need to also employ or reach out to a lot of people, particularly those in the business, private entities, religious body, to team up with the government to make sure that some of this project come to line.
But the thing is, if we're also testing more and perhaps ruling out that department, we probably won't need as many spaces as we're projecting.
We've tested less than 15,000 and we're already about 2,000. If we continue to test at the rate we are testing now, in the next 1 month, we don't know what the case is. As at April 1st, we had 174 cases. By the end of April, we had close to 2,000. In the next 1 month, trust me, with the ease that we're having now, we don't really know what's going to happen. So they need to keep, at this point, they need to start keep building more isolation centers so that we can cater for the cases that will come.
All right, we'd like to thank you, public health physician, Dr. Samuel Okerinde. Thank you for joining us on the program.
Thank you for having me.
We also have Dr. Donnie Beke via Skype. When we come back, we'll also have an infectious disease expert who joins us on the program. That's in a moment. Welcome back. We've been talking with Dr. Donnie Beke, a medical doctor in Illinois, the United States. Thank you for staying with us. I must ask, you know that, of course, we're easing restrictions, Abuja, the FCT, Ogun State, from Monday. And a lot of people have had so many things to say on that, even though we are witnessing more and more cases. What kind of safeguards do you think we workers especially should be looking at as, you know, they prepare to go to work on Monday?
Well, I think it's important for people to have some, personal accountability. We all know that we're supposed to wash our hands, maintain social distancing, wear masks. But I also think there has to be some enforcement of these public health measures. We really need to make sure that people are abiding by these rules. The other thing is employers, they need to help provide their employees with what they need to stay safe in their establishments, providing them masks, providing them gloves, providing, hand sanitizer so they can keep themselves safe. The other thing is, if you have a small market, limit the amount of people that are coming in, maybe limited to 1 or to 2 people at a time. Bigger establishments can demarcate what 6 feet is, because people may not even know what 6 feet of social distancing is. So these are things that they can implement very easily to help keep people safe.
Quickly, the director of Africa's Center for Disease Control said that African countries have the funds to pay for reagents, but they cannot buy them. How do you think we can resolve this, especially solidarity coming together, the African continent?
Yeah, so, unfortunately, we're dealing with a pandemic, so every country in the world is vying for tests. They need tests more and more. So I'm not surprised that, Nigeria and other African countries are having a problem procuring those tests. So it speaks to the importance of having another avenue. In addition to importing tests, it's important to maybe start looking at ways to developing our own. I know I read, Senegal is starting to create a rapid test that has been, pretty accurate. So that's something we may need to start looking into. What are our other African countries doing? Can we work together to create something for ourselves?
All right, we appreciate your time on the program. Dr. Donnie Beke, medical doctor at Illinois, the U.S. Thank you for joining us.
Thank you.